Ever wondered what causes kidney stones and how they can be managed? Well, you're not alone. Kidney stones, also known as renal calculi, are hard deposits composed of minerals and salts that form inside your kidneys. They're somewhat of a mystery, often resulting from a blend of genetic and environmental factors. Kidney stones may seem like small, inconsequential formations, but they can lead to significant discomfort and complications if not managed properly. This video aims to shed light on these tiny troublemakers, discussing their causes, how they are diagnosed, possible treatment strategies, and potential complications that can arise if they're left unchecked. Understanding kidney stones is the first step towards effective management and prevention. So, whether you're a health enthusiast, someone who has experienced kidney stones, or simply a curious learner, this video will provide a comprehensive overview of this common health issue. Please subscribe to our YouTube channel for access to precise and educational health information. So, what causes kidney stones to form in our bodies? Well, kidney stones are created when certain minerals concentrate in the urine and the body lacks substances to prevent these minerals from crystallizing. There are four main types of kidney stones. First, we have calcium stones, the most common kind. These are typically in the form of calcium oxalate, and high oxalate levels can be caused by diet or certain metabolic issues. Foods high in oxalates like spinach, rhubarb, and almonds can contribute to the formation of these stones. Next up are uric acid stones. These tend to form in people who consume a high-protein diet, those with gout, or those who are frequently dehydrated. Then we have struvite stones, which often result from kidney infections. These stones can grow quickly and become quite large, making them particularly problematic. Finally, there are cystine stones. These are rare and usually occur in families due to a condition that causes cystine to leak into the urine. Now let's talk about risk factors. A family history of kidney stones can increase your chances of developing them. Dehydration, diets high in protein, salt, or sugar, and obesity are also risk factors. Additionally, certain digestive diseases and other medical conditions like renal tubular acidosis, cystinuria, and hyperparathyroidism can contribute to the formation of kidney stones. Understanding these causes and risk factors is vital. It not only helps in identifying why kidney stones may have formed in the first place, but also aids in preventative measures, which we'll delve into later on. It's about equipping ourselves with the knowledge to better manage and mitigate the impact of kidney stones on our health. With these causes and risk factors in mind, let's explore the symptoms of kidney stones. How do you know if you have kidney stones? Well, the symptoms can vary greatly. Some stones are small and pass unnoticed through the urinary tract, but larger ones can be quite painful. The most common symptom is severe pain that starts suddenly. This pain typically begins on one side of your back or abdomen and can spread to your groin area. It may come in waves, fluctuating in intensity. Another sign of kidney stones is discomfort or pain during urination. This could be accompanied by an unusual color in your urine. It might be pink, red, or brown, indicating blood. Other symptoms can include feeling nauseous or vomiting. You might also feel a persistent urge to urinate even after you've just gone. And if an infection is present, you may experience fever and chills. These symptoms can be alarming. If you're experiencing these, don't hesitate to seek medical help. If you're experiencing these symptoms, it's important to get a diagnosis. Let's find out how. Diagnosing kidney stones involves a combination of clinical evaluation and diagnostic tests. The first step in this process typically involves a thorough review of the patient's medical history and a physical examination. This helps the doctor to understand the patient's symptoms, lifestyle, and any potential risk factors that could contribute to the development of kidney stones. Next, blood tests might be ordered. These tests can provide valuable insights into the patient's overall health and reveal any abnormalities, such as high levels of calcium or uric acid, which could indicate the presence of kidney stones. In addition, these tests can also help to identify any other medical conditions that might be contributing to the problem. Urine tests are another important diagnostic tool. A 24-hour urine collection test can provide a comprehensive picture of what's happening inside the body. Urine tests can detect excess amounts of stone-forming minerals or a lack of substances that prevent stone formation. For instance, low levels of citrate, a natural inhibitor of stone formation, can make someone more susceptible to developing kidney stones. This information can be instrumental in determining the underlying cause of the kidney stones and devising an effective treatment plan. Imaging tests are often used to identify the size, location, and number of kidney stones. Non-invasive tests like CT scans are commonly used for this purpose. They provide detailed images of the kidneys and the urinary tract, allowing doctors to see any abnormalities. Ultrasound or X-rays can also be used, although they may provide less detailed images. The results of these tests, combined with the information gathered from the medical history and physical examination, enable doctors to make a definitive diagnosis. It's important to note that each patient's situation is unique, and the diagnostic process may vary depending on the specific circumstances. Once the presence of kidney stones is confirmed, the focus shifts to management and treatment. The goal is to alleviate the patient's symptoms, prevent further stone formation, and, if necessary, remove any existing stones. The specific treatment plan will depend on the size, type, and location of the stones, as well as the patient's overall health and personal preferences. Once diagnosed, the next step involves management and treatment. The treatment for kidney stones depends on the stone's size and location. If we're dealing with small stones and minimal symptoms, most won't require invasive treatment. You might just need to take some pain medication and drink lots of water to pass the kidney stone. It's a bit like waiting for the storm to pass, with the storm being a tiny, jagged mineral mass. However, large stones and those causing severe symptoms might require more extensive treatment. This is where we get a bit more hands-on. One option is shockwave lithotripsy, or SWL for short. Here, sound waves are used to break up the stones into small pieces, kind of like a mineral piñata. These tiny pieces can then be passed in your urine. It's non-invasive and generally very effective. If that doesn't do the trick, we might consider ureteroscopy. In this procedure, a thin scope is inserted through the urethra and bladder into the ureter. This allows the doctor to either remove the stone or break it up. Think of it as a sort of search and destroy mission. In rare and more severe cases, we might resort to percutaneous nephrolithotomy. Now, this is a surgical procedure where kidney stones are removed via a small incision in your back. It's more invasive than the previous methods, but sometimes it's the best or only option. Remember, every case is unique, and your doctor will recommend the treatment that's best for you. It might be a simple waiting game, or it might involve a little more intervention. Either way, the goal is to get you feeling better and to get those stones out of there. But what if we could avoid the stones in the first place? That would be ideal, right? Well, that's where prevention comes in. The saying, "an ounce of prevention is worth a pound of cure," is especially true when it comes to kidney stones. Beyond treatment, prevention is key. Let's look at how to prevent kidney stones. Prevention is better than a cure, especially when it comes to kidney stones. The adage holds true, as preventing kidney stones can save you from a world of discomfort. One of the most effective ways to prevent kidney stones is to stay well hydrated. Drinking water throughout the day helps dilute the substances that can form stones. Aim for at least 8 glasses of water per day, more if you're active or live in a hot climate. Diet also plays a crucial role in preventing kidney stones. Limit your intake of oxalate-rich foods such as spinach, rhubarb, and almonds, as these can contribute to the formation of calcium oxalate stones. Also, a diet low in salt and animal protein can help reduce your risk. However, while it's important to limit dietary oxalate and animal protein, don't shy away from calcium. It's a common misconception that calcium contributes to kidney stones. In fact, calcium-rich foods can help prevent these stones by binding to oxalate in the gut, reducing its absorption into your body. Lastly, maintaining a healthy body weight through regular exercise can also help prevent kidney stones. Obesity increases the risk of stones, and regular physical activity can help manage this risk. By understanding the causes, symptoms, diagnosis, and treatment of kidney stones, you can take steps to manage your health better. Remember, prevention is the key, and a few simple lifestyle changes can make a world of difference. Let's recap what we've learned about kidney stones. These hard deposits form when certain minerals concentrate in urine. They can cause severe pain and are diagnosed through a mix of physical exams, blood and urine tests, and imaging. Treatment depends on the stone's size, from simple hydration to surgical procedures. Prevention focuses on hydration, diet modification, and avoiding certain supplements. Remember, knowledge is power. Stay informed and take care of your health. Please subscribe to our YouTube channel for access to precise and educational health information. Thanks.